Hi, I am Dr. Yeshwant, Director, Atharva Infertility Center, Nasik. Today we will be discussing upon a very serious issue of IVF that is called as repeated implantation failure. A female undergoes multiple embryo transfers in spite of having good embryos, good endometrium and a good embryo transfer technique, still fails to conceive. This is called as repeated implantation failure. IVF has made tremendous success over the last 40 years. When IVF was started in the year 1978, the initial days the success rate were less than 10 or 20%, and this success rate continued in the same range up to 40% till early 90s and early 2000. But with better understanding of the subject, better hormones for follicular development, better culture medias, better incubators and skilled embryologists, the success rate of IVF has significantly improved. At Atharva Infertility Center, we have a consistently success rate of 65 to 70 years since last 10 to 15 years. Of all the patients attending the clinic, you cannot expect all the patients to get pregnant in the first attempt. Some may conceive in the second attempt, some may conceive in the third attempt, or some may not conceive even after the third attempt. So these patients with repeated multiple failed IVF cycles, they need to understand what is the major problem. The patients have the guilt feeling that why my body is not accepting in spite of having good embryos, good endometrium. Now there are certain factors which need to be identified and treated in cases of repeated implantation failure. The most important factor is anatomical factors in the uterus. Some patients may have a septum in the uterine cavity, some patients may have adhesions in the uterine cavity because of a previous infection. The most common infection found in India is tuberculosis, or the patient could have a polyp. So if you do a pre-IVF hysteroscopy in these patients, you can identify these factors and you can rectify those problems. So if you do an embryo transfer in cases of uterine septum, these embryos are not going to implant in the presence of the septum, because the septum is an avascular curtain which is dividing the endometrial cavity into two. If the patient is having a submucosal fibroid, if it is disturbing or indenting the endometrium, it will hamper the implantation by release of certain prostaglandins. If the patient has had previous infection of tuberculosis and there are multiple adhesions in the endometrial cavity, these adhesions will prevent implantation. So they need a hysteroscopic adhesiolysis and they require AKT, anti-tuberculosis treatment for a period of 6 to 9 months, and they can try after that. If there is a small polyp, you can definitely remove the polyp by hysteroscopy and clear the anatomical defect in the endometrial cavity. Now the functional defect in the endometrial cavity. Now every endometrium has an implantation window. That means implantation window extends usually from 19th to 24th day of the menstrual cycle. This is a natural cycle. But IVF cycles, these are all programmed cycles. So the implantation window will vary from cycle to cycle. So identifying the exact implantation window and transferring the embryos in the implantation window period will ensure a better success rate. So there are certain tests called as ERA, that is endometrial receptivity assay, which is done in the cycle preceding the actual embryo transfer, and the implantation window is identified and the embryos are transferred in the implantation window period. There are certain other factors like immunological factors which are responsible for embryos not getting attached into the endometrial cavity. So this group of patients may require certain immunoglobulins, steroids and low molecular weight heparin to ensure a better success rate. If more than 5 failed IVF cycles with good embryos, good endometrium, good blood flow and a good embryo transfer technique, if the female still doesn't conceive, then this group of patients will have to think for a gestational surrogate. So gestational surrogacy may help in this group of patients for achieving a pregnancy. If you have any queries further, be free to contact us on the number given below.